Second, second point I'd like to make in this regard is I was not involved in negotiations with pharma, but I believe that the administration was, obviously pharma was, and I presume this committee was involved in some way in those negotiations. And what pharma agreed to do through those negotiations is to pay about $80 billion over 10 years to help fill up half the donut hole. That's my understanding. And they are prepared to go forward and to honor that commitment. As I understand it, the amendment from our colleague Senator Nelson would basically double what was negotiated with pharma, and whether you like pharma or not. Remember I talked earlier today that our opening statements, I talked about 4 core values. One of those is golden rule, treat other people the way I want to be treated. I'll tell you, if somebody negotiated a deal with me and I agreed to put up, we'll say, $80 or $80 million or $80 billion, and then you came back and said to me a couple of weeks later, oh, no, I know you agreed to do $80 billion, and I know you were willing to help support through an advertising campaign this particular, not even this particular bill, just the idea of generic health care reform. No, we're going to double what you agreed in those negotiations to do. That's not the way, that's not what I consider treating people the way I'd want to be treated. That just doesn't seem right to me. And whether you like pharma or not, we have a deal. I think they're willing to abide by the deal. They're willing to put up their money. They're willing to put up their money to help encourage people in this country to support health care reform. And now we're going to say we want to double the amount you committed to contribute. That just doesn't seem fair.